Hey everybody, this is Penguin Speaks. I've reached out and been reached out to by a lot of people concerning my stroke. It seems to be one of the main topics. And it's a good topic actually, because there's a lot to be learned from the doctors and the people who have experienced a stroke and survived the stroke, not only from the patient's point of view, but also from the family's point of view. So I'm going to talk to you about this today. This will probably be one of my longest videos, and this will probably be one that's going to be edited and overdubbed because it's going to take a while to get this. And I'm going to tell you this from the start. Feel free to ask me any questions. Reach out to me. I'll answer any comments. You can email me, whatever you want to do. Put your comments down below. Like and subscribe so you can get updates on other people's views. So basically, what is a stroke? We know if you're here, you probably already know there's two types of stroke. There's a bleed or an aneurysm, and then there's what's called an ischemic. A bleed or an aneurysm is basically that. An aneurysm is a bubble that gets on a blood vessel and then it pops. And it causes a brain bleed and kills that brain tissue. Well, mine was a ischemic, which by definition that means lack of blood flow or lack of oxygen supply. So I had a clot. It's on my right side, very close to midline, and which affects the left side of your body because it was on my right side. If it was on the left side, it would affect the right side. So that's how a stroke works. What caused the stroke? My diabetes, I thought I had under control, and I took it upon myself to, I guess you could say, not take have more treatment for it. I really wasn't watching it, but I felt good. I didn't have any of the symptoms that diabetes was having a bad thing. Where your A1C is, I think it's supposed to be between 5 and 6. Mine was 14. And I was a walking, ticking time bomb, is what the doctor said. That's what caused my stroke. So that's where we are. I got up that morning. It was a Tuesday, March the 10th, and I drove a school bus at the time. I was between big time jobs, and that was just something, had a CDL with driver, passenger, and all that thing. So I was doing that. Fortunately, I was not driving a bus full of kids when this happened. I was actually waiting with another driver to learn to drive a specific type of a bus that I wasn't trained on yet. They're called pushers, where the engine's in the back. And you have to get trained. It's a different type of bus. They're a little bit longer than your normal standard school buses are. So we're sitting there waiting on the first group of kids to come. And I just really felt weird. I couldn't move my arm. I couldn't move my hand, couldn't lift it. I could tell that I couldn't talk. I tried to stretch my mouth and it wasn't working properly. So I asked the driver, I said, how long till we get back to the depot? And she said, well, it's going to be several hours. Why? And I said, I think I'm having a stroke. And she turned around and looked at me, and the blood just drained from her face. She really looked panicked. Immediately she called the supervisor, and he was out. I don't know how far away from the depot we were, but he was out there in less than 5 minutes. I mean, he got there really, really quick. But by the time he got there, and this is the thing, all the symptoms were gone. I was fine. Well, of course, he couldn't let me continue to drive once this happened, and she had witnessed what happened, and nor would I want to, because thank God that didn't happen, as you'll hear later on in this story. But he took me and he said, I just can't let you drive until you get checked out by a doctor and I get a release from him. Fair enough. Take me back to the depot. Got in my car, drove home. Now it's 6:15 in the morning. I wake my wife up and I say, I need you to take me to the hospital. Why? Well, something has happened and I don't feel quite right. I can't go back to work until I get a doctor's note. So she said, well, what happened? I explained it to her. And she said, well, you look fine. You look okay. And then she got to listen to me talking. And then she could actually hear a difference in my speech pattern. I don't have any videos of the way that I used to speak before the stroke. I wish I could give you that and show you that. I'll try to find some recordings somewhere possibly. But I articulated the English language very well. And I used to pride myself on that. I would speak very proper, very precise, and I enunciate the words as they should be. If you ever watch the show Friends, Ross, they make fun of him the way he speaks. Well, I didn't go to that extent, I don't think, but that's the way that my wife describes it. But I'm very fluent in the English language, and I used to pride myself on that. Well, she noticed that something was off. I mean, as of now, at the point that time we were together, I think 19 years, and so she got up, she drove me to the hospital, went up to the desk, explained to them what happened. So I think I had a stroke or I'm having a stroke, and they gave me the stroke test, which is fast. Um, I can't remember what it stands for, but they do tests on you, make you smile, try to lift your arm, everything like that. I did fine on all that. They said, well, I don't think you're having a stroke, but we're going to go ahead and take you back, and your priority, because this is a major thing, and we're going to see what's going on here. So doctor come in, they ran blood tests and did a lot of things, and took me for a CT. And when we came back from the CT, he said something interesting. He said, I can't really tell, but there's something's not right. So we're going to go ahead and admit you, and we're going to keep you. Well, at that point, and that's the final memory that I have up until a couple days later. At that point is when the massive full-on stroke hit. My wife actually has a video of my actions in the emergency room and where I'm trying to speak, I'm trying to do things and I can't do it. And it's heartbreaking for me to watch, but I don't know what else to say about it. Anyway, so she immediately yells for the doctor, hey, something's not right. He immediately rushes in, does some more testing and says, he's having a stroke, and it's right now. And thank goodness it's right now, because we're in the emergency room. There really isn't a better place that you could have a full-blown stroke than being in the emergency room, in a bed, being seen with a doctor in the room. So he explained to us the options, and one of them was a drug called TPA, which is called a clot-busting agent. And if you take it in time, which is normally a couple of hours from the onset of the stroke, at times it can completely reverse the results of the stroke. So you can go back to, some people, it's a couple of hours, they're back to perfectly normal, like they were. Like what I had on the bus was called a TIA, temporary ischemic attack. And that's what it would be like if this drug works. But the downside is it can also cause a major, heavier stroke, and it can kill you. We waited out, and the options at that point were to go ahead and do it. So we did. So I took the drug, and I'm still laying in there, and I don't know how long I was there, but I ended up going to intensive care. I'm not sure what the doctor told my wife, because I don't think she really gave me the full story of everything, but I think that it's a case of she just didn't want me to hear. And she told me that he came back in the room, which again, I don't remember. And he said, I apologize for what I said earlier. He said, I'm looking at things, and this is actually a major stroke. The next 24 to 48 hours are critical, because we don't know what's going to happen. We don't know the extent, because unfortunately, just on a CT scan or an MRI, you can't really see the result of the stroke yet, because the brain is just now starting to die. But they can do a contrast, but I'm allergic to the dye. The dye contains iodine, the dye that they had anyway, and that would send me into respiratory arrest. So who knows? That's why we had to wait that long to see what's going to happen. So they told my wife, we don't know. We can't even give you, he's got this chance, this chance, this chance. He may not make it. And I was 45 years old, so that was really hard. She was 44 at the time. And that was really hard for her to hear. Her husband of almost 20 years may not make it out of the hospital. And I can understand her sorrow, which she went through. I'll get to that either in this video or another video. So I'm in intensive care, and I can't eat, I can't swallow, I can't do anything. They had to crush pills up to give them to me. Some medicines don't come in a liquid or injection form, they're pill only. So they had to give them to me. And they made the worst mistake is they put him in applesauce for me to try to swallow. He was covered in applesauce after that. I can't stand applesauce. So But so I'm in intensive care for a few days, and I guess I'm starting to do better. I don't remember. I had friends come up and visit, family and everything. I don't remember it. My wife said that she helped me take a shower. I don't remember it. So my first memory after the stroke was, I think, the fourth or fifth day after the stroke. It was a Saturday or a Sunday when they transferred me to the rehab facility. And while in there is where I really started remembering things. Not necessarily when I first arrived there, but I remember vaguely them doing the assessment of me. How much movement do I have? Can I walk? What can I do so that they can start their game plan for me? I think I got assessed on a Sunday because they don't do any therapy on Sunday. It's a free day. That's when a lot of family comes to visit and things like that. So they wanted to get the assessment done so Monday they could start on the game plan, which they did. So I'm going to end this video for now, and I may upload it as part 1 and then do a part 2. I'm not sure. I may edit this and make it a longer video. So I appreciate it. Again, ask me anything, any questions. There's not much that I haven't learned about stroke. The medications, the pain, the tremors, anything. I've gone through just about all of it. So don't forget to like and subscribe. Penguin Speaks. Peace out.